Rachel Tobin, editor-at-large for Citybiz, and today we're talking with Joanna Fuller-Crawford about her company, Perfect Care Nursing. Hi, Joanna. How are you?
I'm doing great, Rachel. How are you today?
Doing great. I'm excited to jump in. Why don't we get started? Tell us about Perfect Care Nursing and your mission, and why did you found this company?
So, Perfect Care Nursing is a private home care provider business that cares for any client who has needs with ADL, such as going to the doctors, light housekeeping, making doctor's appointments, walking around, exercise, filing physical therapy orders, or even we also do the skilled side, which is IV therapy, antibiotics, as well as wound dressing care, and anything that is doctor's orders. And Perfect Care Nursing has been on my heart and on my mind for years. And one day, my brother and I I think we were at Mother's Day dinner or something like that. And he looked at me and said, "I'm waiting on you." I said, "What do you mean you're waiting on me?" I said, "You could have let me know, a long time ago that we're ready to start this business because I'm ready." And so then that's how Perfect Care Nursing came about. And then from there, we just kind of put it together to see exactly what our mission was. We knew definitely that we wanted to make sure that we catered to the elderly, families who need respite care for their family members, as well as family members who have adult children, with disabilities and have needs that need to be met as well. So we kind of decided to just go ahead and do skilled and unskilled nursing.
Well, you led me right into my second question, which is, what is it like being part of a family-owned business? Tell me about that.
It's very interesting being a part of a family-owned business because we see each other almost every day, or we talk almost every day. Sometimes business and family it kind of intermingles and mixes together. So what I have to do basically is pull back a little bit just to remember that this is family time. This is not business. But at the same time, it's funny because sometimes we have to kind of reel each other in when it's business time because, we get kind of lax and comfortable. But it has been a great, great pleasure working with family because everyone's bringing different aspects and different strengths to the company. So with that being said, and I guess the trust is already there. So it's not as bad as just starting out and jumping out and going through employees for different roles within the company. So right now, because it's family owned, it's easier to manipulate and to deal. So, but it's great. Just have to have a lot of patience. A lot of patience.
A lot of patience. And do you plan to make this a family legacy business, something you leave to your family?
Yes, most definitely. We definitely want to make it a family legacy business. This is one of many that we are actually entrepreneurs of. But this one hits close to home, considering that our parents are in that age range of almost needing help, not needing help just yet, but almost needing help, as well as our cousins, aunts, uncles, and things of that nature. So most definitely we want to make sure it's a legacy and that we pass it down to our other children.
And where are you based? You're in the Atlanta area, right?
Yes, we are. Our office is located in Fairburn, Georgia. We are looking to relocate our office to around Hapeville. We will stay on the south side of Georgia because where we're located, we are maybe 30, 40 minutes away from North Fulton, the South Fulton, the areas that we do serve. So we will stay centrally located, but yes, we are.
And tell me a little more about your personal story. How did you decide to become a nurse?
My grandmother was a nurse. She had 5 children. When her and her husband were divorced, they separated and she took the girls and she needed a career to go into. So she chose to become a licensed practical nurse. So after she became a licensed practical nurse, she actually was the house manager for a Jewish home in Baltimore, Maryland. So whenever I would go and stay with my grandmother, she would take me to her job. And just as a little girl looking up at this huge, magnificent house, with different clients in the home that she cared for, and just watching her work and just the patience and the love that she gave them, it just really, hit home versus working in the hospital, what I have had seen in the hospitals. So that was my biggest drive and my biggest passion. And not only that, she brought that home. She just didn't do that at work, but she brought it home also. She gave the love and the care and the passion to her grandkids as well as the people that she interacted with. She was always an advocate for helping the ones who are out and about, especially at church. So she would definitely lend a hand to the sick and shut in at church. So it was really one of those, this is what I love to do. And it's not something that I'm definitely, paid to do, that I saw in her that made me want to do the same thing.
Oh, that's a great story. And tell me a little bit more about why what you do is so important. And maybe you have some success stories from your patients.
I do. I do. I was working dialysis years ago, and my clients would come in, and my motto, let me go back. My motto is to be proactive instead of reactive. Where I was working was a reactive environment. So for me, I said, okay, I'm not doing any good if I see them here on dialysis. So I needed to get back into the community. So that's why we started the business. That was another reason why we started the business as well. And that was my passion. I was finding that when my clients or my patients were coming to me, their story was, didn't nobody tell me that this would happen? No one would help me with getting my insulin. No one would help me, with getting wound care. No one would talk to me about what my medicine was doing. Even to the point that they would have multi-dosed medications because different doctors, were prescribing them different things for different reasons, where in actuality, my patients did not realize that they could use one medication, versus the 3 or 4 that was being prescribed by the different physicians or doctors. The lack of communication between the doctors who were caring for my client, my patients, one at a time, it just really got to me. It just really got to me. So I said, okay, Joanna, you would do better in the field, out in the open, in the environment, in the homes, versus being here, working for an acute care setting or chronic care setting. A lot of patients that I have come across recently within the business, we had 2 clients actually, now that I'm thinking about it. They actually had, what did they have? They were in the hospital. And when they left the hospital, they were sent home with PICC lines in their arm. So I was getting phone calls from both of them, from the patient and from the wife of one of my other patients. And they were upset, and they were just really outdone. Like, oh my goodness, what am I going to do with all this stuff? So what was happening was the case manager was sending, and I understand where the case manager was coming from. So it's really nobody's fault. I'm not going to say it's anybody's fault, but they would send and make sure all the supplies and everything's at the house. But as a patient who is basically, in layman's terms, to medical, seeing all these boxes come in your house and sitting around and, filled with syringes and tubes and bags, and you're looking like, what am I supposed to do with this? And so that's how they were. So when they called me, I said, not a problem. I said, I'll come out, do an assessment, and then I will let you know exactly, what needs to be done. So one client, this was skilled nursing. We went out to them 2 times a day, Monday, 7 days a week. Yep, 7 days a week. And the other one we went out 3 times a day because she had to have antibiotics given 3 times a day. So the relief in the thank you and the appreciation that I got from them, because I sat down and took my time and explained to them what it was, what was going on. I can almost say I'm a patient advocate to a certain extent in the field, because when they would also ask me, so what do I need to do here? Who do I call for this? And then I would let them know, where to start. First, go back to your case manager, find out exactly who they referred to you. They can give you the number. Then from there, you can call that person, and then that doctor, they need information from your doctor. Then you call your doctor's nurse. So that's just a little bit of um, of a story that has actually recently happened with us. You have other other stories that are not as, how do you want to say, successful, but in the end, it was very successful.
Well, it's great to hear that. So, part of what you do is being a patient advocate. So, who makes a good nurse? Um, how do you become a great nurse and a patient advocate? Who are you recruiting? What kind of person?
I am recruiting individuals who care genuinely from the heart. Individuals who have a sense of emotional, emotional expression or emotional connection with others. Because sometimes the reaction we get from our clients is one that can come off as being unappreciated, but they're not unappreciative of what we do. They don't understand what's happening, or they do not understand what has happened. They do not understand what the next process is. So fear, uncertainty, and the unknown has set in. So once you come in as the caregiver or the nurse, that's one of your jobs that you need to do. Even if you have 5 minutes, give them those 5 minutes of clarity, on their level. Not everyone can understand IV or blood transfusion and the reasons why and anemia. So, slowly break it down in just 5 minutes. Let them know exactly what happened. Will you have to re-educate? Yes, you will. Because again, grief and trauma are right there at the top. So they're probably not, containing or listening to everything that you're saying at that time. So if you go into this field, make sure you have patience, make sure you have a heart for caring, make sure you have a love for helping others and making sure that what you do at the end of the day, you see a full, genuine success.
That's excellent. And tell us about some milestones with your business.
One huge milestone is we made it through the pandemic. Woohoo! So I can definitely say that. Another milestone is that my goal when I left corporate America was to make sure that my annual income would become my quarterly income, and we have met those expectations as well. Another one of my goals was to make sure that our communication in between clients and caregivers is open, is concise, and as clear as possible. And that we have met. A lot of my clients and my caregivers are very grateful, and I tell them, call me anytime. It doesn't matter what time it is. Or text me anytime, and I'll get back to you, especially if it's something demanding or it's something that they need an answer for. I don't mind answering. So the biggest thing was just those top three missions that I'm glad that we accomplished.
And what are some challenges you faced in your business as an entrepreneur or as a caregiver navigating our healthcare system? What are some of the challenges you've been overcoming?
Challenges. Let's see. I think one of the biggest challenges is finding caregivers. And when I say caregivers, I do mean quality. I'll say quality caregivers. CNAs, HHAs, PCAs, companions, LPNs, RNs. A lot of them look for additional bonuses or appreciation gifts based off of what they do. But in the healthcare field, that's not something we can look for because it's not something you're going to get, unfortunately. At the end of the day, but I do understand that they would want to be appreciated. That I completely understand. Um, but as far as expecting monetary appreciation all the time, that's where a lot of our issues are standing now with hiring quality caregivers. Sometimes the monetary aspect will oversee or overshadow the ability to care and provide appropriate care and proper care to the clients. So that's our biggest challenge right now, just hiring adequate, compassionate care and caregivers.
That's very interesting. And Joanna, how would you like to grow your business over the next 5 years? What are some goals?
Yes, perfect. So in the next 5 years, I would like to open a personal care home. Not too big, maybe about 6 to 12 clients. I think that if we get bigger than that, then it will kind of water down our mission and our values and everything that we stand for. So definitely about 6 to 12 clients, um, along with still continuing with Perfect Care Nursing. So we will provide in-home care as well as personal care home where they can come into a facility and have their needs met there as well.
And tell us, what are you seeing in terms of trends in healthcare, especially for people who might have traditionally been underserved?
Um, I see the lack of trust from the underserved community because they receive, um, unfortunately, a lot of the underserved community, their education level is not past the high school level, shall I say? Some of them are past the high school level, but they still don't understand exactly why. Exactly why. And sometimes caregivers or doctors, they can when they're talking to the underserved community, they're coming with huge words, words that's really not processing or not sticking with them. They're not giving examples that would basically impact their life in a certain way. Like for instance, if you say, "I need you to start watching your diet because insulin is $300 a day now. Every time you get it, and basically that's out of pocket because insurance is really not covering it. Maybe that impact is much greater than you're going to end up on insulin. So that's kind of like, oh, wait a second, I can't be paying $300. The impact it just has to be different in the just the whole aspect of presenting it to the underserved needs to be different, as well as with the underserved because a lot of them, a lot of the underserved, they have a lot of home remedies. So if they think that the home remedies are working, they're not going to listen to the professionals, none whatsoever. Especially if the professional tries, like for instance, they try antibiotic and they're allergic to it and they have a reaction to it, then they're thinking, well, my home remedy, didn't give me this reaction without understanding that we didn't know you were allergic to the antibiotic until we did, till we came to this point. So the mistrust and the, okay, I'm not going back there sets in with the underserved.
Is this extending to right now? We know the monkeypox is a big topic in healthcare. It's an emerging topic. Is this extending to questions about monkeypox or maybe even COVID-19? And how are you handling that? What are you hearing about that?
So I have only heard things about the monkeypox. I have not come into contact with monkeypox, knock on wood. But I have heard that the monkeypox has basically hit Georgia, and that it is highly contagious. It is skin to skin contact. Um, I'm curious to know and have not heard if it's viral yet. Airborne, not viral, but airborne. I apologize, airborne. So that's going to be interesting if it is. Well, so far, I have not heard that it is. The uptick in monkeypox is really scaring everyone. We're still in COVID. We're not quite completely out of COVID. So we're still in COVID, and now all of a sudden we have the monkeypox on top of COVID. So a lot of individuals they're scared to go out now. They're really, really scared, to go to work, even to go to the grocery store. You know what I mean? It's because people do not respect space anymore. Even with COVID, you would have thought that they were still staying 6 feet apart, but people still do not respect space. And I don't think it's intentional. I think it's just we have so much on our mind and we're just like focused and do not realize that we're so close to someone. But yeah, monkeypox has been interesting in the last couple of months, as well as the, in my opinion, connotative opinion about it coming from gay men, which I don't think that should have, been put out there like that. In my personal opinion, I feel as though that the research was found first, but it can be contacted by everyone. It's just not an LGBTQ, plus disease. So I feel as though that needs to be kind of reconciled, because I don't think, in my opinion, I don't think that's fair.
Well, this is how you do your work as a patient advocate and as, helping people understand the information they're receiving. It might be confusing for multiple levels, right? Well, Joanna, it has been such a pleasure talking with you. Can you tell everyone how to find you?
Yes, you guys can reach me at perfectcarenursing.com.
Excellent. Well, we hope people will reach out to you, and we thank you so much for your time today, and we wish you all the best in your business, Perfect Care Nursing. Thank you so much.
Thank you, Rachel.